I've been a pediatrician for 16 years. When children die in my care, they see people I can't see. Now these same children are guiding me from beyond death, giving me medical knowledge I never learned. Every diagnosis they provide saves a life. Hello everyone. Before we continue, make sure to like and subscribe to the channel and leave a comment with where you're from and what time you're watching. That way, YouTube will keep showing you stories just like this one. Now, let me tell you about the case that destroyed my medical career and everything I thought I knew about death. My name is Dr. Marcus Chen, and I work at Children's Memorial Hospital in Chicago. Or at least I did until I submitted my resignation last week. For 16 years, I've dedicated my life to saving children who suffer from the worst diseases pediatric medicine can encounter: cancer, genetic disorders, organ failure, and conditions so rare they don't have names. But what I'm about to tell you will challenge everything you believe about death, consciousness, and the bond between doctor and patient. Children's Memorial is one of the leading pediatric hospitals in the Midwest, with specialized units for treating the most complex childhood diseases. I worked primarily in the pediatric intensive care unit and the oncology ward, where I cared for children whose conditions were often terminal. In 16 years, I watched 347 children take their final breaths. Each death taught me something about medicine, about courage, and about the incredible strength that children possess even in their darkest moments. But it wasn't until 3 months ago that I learned something that fundamentally changed my understanding of what happens when a child dies. October 18, 2024. I was working the night shift in the PICU when 8-year-old Emma Rodriguez was admitted with acute lymphoblastic leukemia that had stopped responding to treatment. Emma was a bright, energetic girl who loved drawing pictures of butterflies and always asked me about my stethoscope. Her parents, Maria and Carlos, had been fighting her cancer for 2 years, and we all knew this hospitalization would likely be her last. Emma's condition deteriorated rapidly over the next 48 hours. Her white blood cell count was dangerously low, her organs were beginning to fail, and despite our best efforts, she was slipping away from us. On the evening of October 20th, I was sitting beside her bed, holding her small hand while her parents dozed in the chairs nearby. "Dr. Chen," Emma whispered, her voice barely audible above the sound of the machines monitoring her vital signs. "Do you see them?" I looked around the dimly lit room, seeing only the medical equipment, her sleeping parents, and the soft glow from the hallway lights. "See who, sweetheart?" "The other children," she said, her eyes tracking movement that I couldn't detect. "They're standing right there by the window. There's a boy with curly hair, and a girl with a pink dress, Aunt. Oh, there's more of them now." I had heard dying children describe visions before. Medical literature suggests these experiences are caused by brain chemistry changes during the dying process, hallucinations brought on by medication or oxygen deprivation. But Emma's descriptions were remarkably detailed and consistent. She spoke with these invisible children for nearly an hour, having conversations that seemed as real to her as our discussion. "They're telling me it doesn't hurt," Emma said, looking directly at me with eyes that seemed far too wise for an 8-year-old. "They say there's a beautiful place where children can play forever, and they're going to show me how to get there." Emma Rodriguez died peacefully at 3:17 a.m. on October 21, 2024. Her last words were directed toward the empty space by the window where she claimed to see the other children. "I'm ready," she whispered. "Thank you for waiting for me." I pronounced Emma's death with the same professionalism I had maintained through hundreds of similar cases. I comforted her parents, completed the necessary paperwork, and prepared for the next patient who would need my care. But something about Emma's final hours stayed with me in a way that previous deaths hadn't. 3 days later, everything changed. I was examining a 6-year-old boy named Tyler Matthews who had been admitted with symptoms that didn't fit any clear diagnostic pattern. He had a persistent fever, unexplained rash, and blood work that showed inflammatory markers but no obvious infection. Multiple specialists had examined Tyler, but no one could determine what was causing his illness. I was reviewing Tyler's chart in the nurse's station when I heard a voice that made my blood run cold. "Dr. Chen, check his heart." I looked up from the medical records, expecting to see one of my colleagues offering a suggestion. But the hallway was empty except for a night nurse who was reviewing medications at the far end of the station. The voice had been clear and distinct, spoken in a tone I recognized but couldn't place. "Check his heart for endocarditis," the voice repeated, and this time I realized why it sounded familiar. It was Emma Rodriguez's voice, as clear as if she were standing right beside me. The dead 8-year-old girl was giving me medical advice. I tried to dismiss what I was hearing as auditory hallucination brought on by stress and fatigue. Working in pediatric intensive care takes an emotional toll, and I assumed my grief over Emma's death was manifesting in unusual ways. But something compelled me to follow the advice I had heard. I ordered an echocardiogram for Tyler Matthews, a test that none of the other physicians had considered necessary because his symptoms didn't suggest cardiac involvement. When the results came back 6 hours later, they showed clear evidence of bacterial endocarditis, an infection of the heart valves that can be fatal if not treated promptly. Tyler was immediately started on targeted antibiotic therapy, and within 48 hours, his fever broke and his symptoms began to resolve. The diagnosis had saved his life, but I couldn't explain how I had known to order the specific test that revealed his condition. Excellent diagnostic work on the Matthews case, Dr. Sarah Williams, our chief of pediatrics, told me during rounds the following morning. "What made you think to check for endocarditis?" His presentation was completely atypical. I couldn't tell her that I had been guided by the voice of a deceased patient. Instead, I mumbled something about following my clinical instincts and moved on to the next case. But I knew that what had happened couldn't be explained by medical training or diagnostic experience. Over the next 2 weeks, I heard Emma's voice 3 more times, each instance providing medical guidance that proved to be crucial for saving a child's life. She directed me to order a specific genetic test that revealed a rare metabolic disorder in a newborn whose symptoms had baffled the entire medical team. She warned me about a drug interaction that could have been fatal for a patient with cystic fibrosis. She even provided detailed instructions for a surgical approach that successfully treated a child with a complex congenital heart defect. Each time Emma's voice provided medical guidance, her advice was not just correct but demonstrated knowledge that exceeded my own expertise and training. She was giving me information about pediatric conditions that I had never encountered, treatment protocols that weren't in textbooks, and diagnostic techniques that seemed to come from medical knowledge far beyond what an 8-year-old should possess. But Emma wasn't the only one communicating with me from beyond death. On November 8, I was called to examine 5-year-old Jessica Park, who had been brought to the emergency room with severe abdominal pain and vomiting. Her symptoms suggested appendicitis, but her blood work and imaging studies were inconclusive. The surgical team was preparing to perform an exploratory laparoscopy when I heard a new voice that I had never heard before. "Dr. Chen, it's not her appendix. Check for intussusception in the small bowel." The voice belonged to a young boy, and I realized with shock that it was Tommy Morrison, a 7-year-old patient who had died from brain cancer 6 months earlier. Tommy had been one of my favorite patients, a brave little boy who always made jokes even during his most difficult treatments. Following Tommy's guidance, I ordered specific imaging that revealed an intussusception, a condition where part of the intestine telescopes into itself, causing the symptoms Jessica was experiencing. The condition was corrected with a non-surgical procedure, saving Jessica from unnecessary surgery and potential complications. "How did you know to look for that?" Dr. Williams asked me after Jessica's successful treatment. "The radiologist missed it on the initial scans." Again, I couldn't provide an honest answer. I was being guided by medical knowledge from deceased children, receiving diagnostic advice from patients who had died in my care months or even years earlier. It was impossible to explain, but it was undeniably real and consistently accurate. As the weeks passed, I began to hear from more children who had died under my care. Each voice was distinct and recognizable, belonging to patients whose names, faces, and final moments I remembered perfectly. They would appear at crucial moments during medical emergencies, providing guidance that invariably led to life-saving diagnoses and treatments. 7-year-old Michael Thompson, who had died from leukemia 2 years earlier, guided me through treating a child with a rare blood disorder that I had never encountered before. 10-year-old Sarah Martinez, who had succumbed to cystic fibrosis, provided detailed instructions for managing a patient with severe respiratory complications. 4-year-old David Lee, who had died from a genetic condition, helped me recognize the same disorder in another child early enough to begin preventive treatment. The medical knowledge these children provided was far beyond anything they could have possessed during their lifetimes. They were giving me information about conditions they had never been diagnosed with, treatments they had never received, and medical procedures they had never witnessed. Yet their guidance was always precise, always correct, and always arrived exactly when it was needed to save another child's life. But perhaps the most disturbing aspect of these encounters wasn't the impossible medical knowledge the children possessed. It was what they told me about their experience of dying and what existed beyond death. Dr. Chen, dying isn't what you think it is, Emma's voice explained during one of our conversations late one evening as I reviewed patient charts in my office. We don't just disappear. We go to a place where all the children who've died are together, and we can see everything that happens in the hospital. We can see which children need help, and we know how to help them. Why are you helping me? I asked, speaking aloud despite being alone in my office. Because you cared about us when we were alive, Tommy Morrison's voice replied. You held our hands when we were scared, and you never gave up trying to save us. Now we want to help you save the children who still have a chance. These conversations revealed that the children existed in some form of collective consciousness after death, maintaining their individual personalities while sharing knowledge and awareness that transcended their earthly experiences. They could observe everything that happened in the hospital, identify medical problems that living doctors might miss, and provide guidance based on medical knowledge that seemed to come from some universal source. We learned things here, Sarah Martinez explained during another late-night conversation. Not the way you learn in medical school, but by understanding how bodies work and what makes them sick. We can see inside patients in ways that your machines can't, and we know what will help them get better. The children described a realm where they continued to exist as themselves while having access to knowledge and awareness that far exceeded what they had possessed during their lives. They spoke of watching over other patients in the hospital, feeling connected to children who were suffering, and wanting to use their enhanced understanding to prevent other families from experiencing the loss they had endured. But as my reliance on their guidance grew, I began to question my own medical judgment and training. Was I becoming dependent on supernatural assistance rather than developing my own diagnostic skills? Were these voices enhancing my abilities as a physician? Or were they making me less capable of practicing medicine independently? The ethical implications were staggering. How could I explain to parents that I had diagnosed their child's condition based on advice from a deceased patient? How could I document medical decisions that were guided by voices only I could hear? And most importantly, what would happen to my patients if these voices suddenly stopped providing guidance? These concerns came to a head during one of the most challenging cases of my career. 11-year-old Brandon Walsh was admitted with the condition that had stumped every specialist who examined him. He was experiencing progressive neurological symptoms, including seizures, memory loss, and motor function deterioration. Extensive testing had ruled out brain tumors, infections, and genetic disorders. But his condition continued to worsen despite all treatment attempts. Brandon's parents, Jennifer and Robert Walsh, were desperate for answers. Their son was dying from an unknown condition, and no one in our hospital could determine what was causing his rapid decline. I had exhausted every diagnostic possibility I could think of, and Brandon's neurological function was deteriorating so rapidly that we estimated he had perhaps days to live. That's when I heard from a child whose voice I had never expected to hear again. Dr. Chen, I can help you save Brandon. The voice belonged to Lisa Chen, my own daughter, who had died in a car accident 8 years earlier when she was only 6 years old. Hearing her voice was both the most comforting and most terrifying experience of my life. Lisa had never been my patient, had never died in the hospital, and had no connection to the other children who had been guiding my medical practice. Lisa, I whispered, my voice breaking with emotion I hadn't allowed myself to feel since her death. Yes, Daddy, I've been watching you help all these children, and I'm so proud of what you're doing. But Brandon needs help that the other children can't provide. His condition is something very rare, something that requires knowledge they don't have. Over the next hour, Lisa provided me with detailed information about an extremely rare autoimmune condition that causes the body's immune system to attack brain tissue. The condition, called anti-NMDA receptor encephalitis, typically affects young women but can occur in children and is often misdiagnosed because its symptoms mimic other neurological disorders. Order the specific antibody test, Lisa instructed with the same gentle voice I remembered from her childhood. The regular blood work won't show it, but if you test for anti-NMDA receptor antibodies, you'll find the answer. Brandon needs immunosuppressive therapy immediately, or he'll die within 48 hours. I followed Lisa's guidance and ordered the specialized test. When the results came back positive for anti-NMDA receptor antibodies, Brandon was immediately started on immunosuppressive treatment. Within 72 hours, his seizures stopped. Within a week, his cognitive function began to return. Within a month, he had made a complete recovery and was back to being a normal, healthy 11-year-old boy. Dr. Chen, how did you know to test for that condition? Dr. Williams asked during Brandon's discharge meeting. Anti-NMDA receptor encephalitis is so rare that most pediatricians never see a case in their entire careers. What made you think of it? I couldn't tell her that my deceased daughter had provided the diagnosis. I couldn't explain that I was receiving medical guidance from children who existed in some form of afterlife consciousness. Instead, I credited extensive research and consultation with specialists, but I knew the truth was far more extraordinary and unexplainable. That night, I had my final conversation with Lisa. Why did you help me save Brandon? I asked, sitting alone in my office after completing my documentation of his case. Because saving children is what you're meant to do, Daddy, Lisa replied, her voice filled with the same love and warmth I remembered from when she was alive. But you can't keep depending on us forever. You've learned so much from helping these patients, and now you need to trust your own knowledge and instincts. Are you saying the voices will stop? We'll always be here if you really need us, Lisa said softly. But you're becoming the doctor you were always meant to be. You don't need us to guide every decision anymore. Over the following weeks, the voices from the deceased children became less frequent. They would still occasionally provide guidance during the most critical cases, but for the most part, I found myself making diagnostic decisions based on my own medical knowledge and the enhanced instincts I had developed through my experiences with their guidance. But the weight of what I had experienced began to take its toll on my ability to practice medicine with confidence. I started second-guessing every diagnosis, wondering whether I was making the right decisions without supernatural guidance. I became anxious about treating patients without hearing from the voices, afraid that I might miss something crucial that they would have caught. The final incident that led to my resignation occurred during a case involving 9-year-old Hannah Morrison, who was admitted with symptoms of acute appendicitis. The surgical team was preparing for an emergency appendectomy when I heard Tommy Morrison's voice warning me that Hannah's condition was actually a rare form of inflammatory bowel disease that would be worsened by unnecessary surgery. But this time, I chose not to follow the guidance from the voices. I decided to trust my own medical judgment and the clinical consensus of the surgical team. Hannah underwent the appendectomy, and while the surgery was successful, the pathology reports showed that her appendix was normal. She was subsequently diagnosed with the inflammatory condition that Tommy had tried to warn me about. Hannah recovered completely, but the incident made me realize that I had become so dependent on supernatural guidance that I was losing confidence in my own medical abilities. I couldn't continue practicing pediatrics while being uncertain about whether my decisions were my own or influenced by voices from deceased patients. I submitted my resignation to Dr. Williams the following week, citing personal reasons and a desire to explore other career opportunities. I couldn't tell her that I was leaving because I had lost confidence in my ability to practice medicine without guidance from dead children. Marcus, you're one of the most gifted pediatricians I've ever worked with, Dr. Williams protested. Your diagnostic accuracy over the past few months has been unprecedented. You've saved lives that other doctors couldn't save. Why would you walk away from that? I couldn't explain that my unprecedented success had come from supernatural sources that I no longer felt comfortable relying on. I couldn't tell her that I was afraid of making a mistake without the guidance of deceased patients, or that I was concerned about the ethical implications of practicing medicine while hearing voices that only I could perceive. I've accomplished what I wanted to in pediatrics, I lied. It's time for me to try something different. On my final day at Children's Memorial Hospital, I made rounds one last time to say goodbye to the patients I would be leaving behind. As I walked through the halls where I had spent 16 years of my life, I heard the voices of the children who had guided me one final time. "Thank you for listening to us," Emma Rodriguez's voice said softly. "Thank you for caring enough to hear what we had to say. You saved so many children because you were willing to believe in something impossible," Tommy Morrison added. "That's what made you special, Dr. Chen." "We'll always be watching over the children in this hospital," Sarah Martinez whispered. "And if another doctor is willing to listen, we'll help them too." As I left the hospital for the last time, I heard Lisa's voice once more. "I'm proud of you, Daddy. You helped so many children live because you were brave enough to listen to the ones who had died. That's something not every doctor could do." I now work as a medical consultant for a children's health organization, developing protocols for pediatric care and reviewing treatment guidelines. It's meaningful work that allows me to contribute to pediatric medicine without making direct patient care decisions while potentially influenced by supernatural guidance. I miss working with children every day, but I know I made the right choice in walking away from a practice that had become dependent on impossible sources of medical knowledge. The voices taught me things about pediatric medicine that I never would have learned through traditional training, but they also made me question my own abilities and judgment as a physician. Sometimes, late at night when I'm reviewing medical literature, I still hear whispers of the children who guided my practice. They tell me about new treatments, warn me about drug interactions, and share medical knowledge that could advance pediatric care. I document what they tell me in research proposals and treatment guidelines, but I never mention the source of the information. The children who died in my care continue to watch over other patients, providing guidance to any doctor who is willing to listen and believe. They exist in a realm where death is not an ending but a transformation, where consciousness persists and knowledge expands beyond the limitations of earthly experience. Their legacy lives on in every child whose life was saved through their guidance, in every family that was spared the loss they had endured, and in the medical knowledge they shared from beyond death. They taught me that the bond between doctor and patient doesn't end with death, and that love and caring can transcend the boundaries between life and whatever comes after. The voices of those 347 children will always be with me, reminding me that medicine is not just about science and training, but about being open to possibilities that exceed our current understanding of consciousness, death, and the connections that bind us to those we care for. And somewhere in Children's Memorial Hospital, they continued their work, guiding other doctors who are willing to listen, saving other children who still have a chance at life, and proving that death is not the end of their ability to heal and help others.